OST is not a reward, but it is a right to have access to the treatment. We understand initially it is important for us to be on the treatment on a daily basis until our doses are adjusted. Is there any treatment where a patient has to go to the clinic on a daily basis? I'm afraid the answer is no. But why with us, with people who use drugs on OST? I have started taking buprenorphine way back in 1999 when I was working as a peer educator, and I used to take on a daily basis. That makes sense because I had to visit to the clinic, I had to visit to the drop-in center on a daily basis. But now for the last 8 to 9 years, I'm on buprenorphine. I have access to the medication at home. With the kind of workload to implement and advocate for harm reduction, it is just not possible to go daily to a clinic or a drop-in center to get my doses. The treating doctors should also understand that trust from a doctor to an individual drug user is the biggest reward, and we feel happy. That's what I feel. It would have not been possible for me to speak or advocate for my fellow drug user at UNGAS 2016 and at many CNDs had I not have access to buprenorphine. Likewise for many others. I'm not a public health specialist or an economist, but just an average educated drug user. But just imagine the time and resources spent on visiting OST clinic for the last 9 to 10 years for me. For many others, it could be 15 to 20 years. If the take-home doses is provided, all this cost and time could be cut down drastically. Economically, how much money and time can we benefit from that and can be saved. We can also prevent new infection of HIV, viral hepatitis, overdose, if take-home doses is provided. It should have been implemented 10 to 20 years back, but COVID-19 is a blessing in disguise. It made it happen in many countries, and it should continue. Take-home doses must become a part of the recommended comprehensive harm reduction services endorsed by WHO, UN, input, etc. So support, don't punish. Let's make this world a better place to exist.